Hi friends, welcome to the channel The Nurse. Here we are discussing about important nursing questions and answers with their brief explanation. So if you are not subscribed to our channel, please subscribe. We will go to our questions, nursing questions and answers with their brief explanation. First question, the drug of choice for warfarin overdose. The drug of choice for warfarin overdose. Protamine sulfate, vitamin K, iron dextran, heparin. So in the case of warfarin overdose, we can give vitamin K. The antidote of warfarin is vitamin K. Protamine is an antidote of heparin. Iron dextran, we are using for iron deficiency anemia. Iron dextran is a drug that is used for the treatment of iron deficiency anemia. If there is iron toxicity, we can use diaphragmatic as an antidote. So iron dextran, it is used for the treatment of iron deficiency anemia. If there is iron toxicity or iron overdose, we can use diaphragmatic as an antidote. So it is clear. Protamine, it is an antidote of heparin. Vitamin K, it is an antidote of warfarin, and iron dextran, it is used for the treatment of iron deficiency anemia. Next question, which among the following is not an autoimmune disorder? Which among the following is not an autoimmune disorder? Rheumatoid arthritis, myasthenia gravis, pernicious anemia, osteoarthritis. Here, correct answer is osteoarthritis. Rheumatoid arthritis, myasthenia gravis, etc. We know it is an autoimmune disease. But in the case of pernicious anemia, there are several causes. In that, one of the causes is autoimmune disorder, that is antibody against the intrinsic factor of the stomach lining. So the antibodies destroy the intrinsic factor, which is helped for the absorption of vitamin B12. So that is one of the cause for pernicious anemia. Vitamin B12 deficiency, that is a major cause for pernicious anemia. In the autoimmune disorder, the antibodies that is developed under our body that destroys intrinsic factor which lines the gastric mucosa. So I think it is clear. So we can go to next question. Which among the following is not an oncological emergency? Which among the following is not an oncologic emergency? Hypercalcemia, superior vena cava, septic shock, neutropenia. Which one is not an oncological emergency? So here correct answer is neutropenia. So I will explain what are the major oncological emergencies that we are seeing in our hospital scenario. It includes superior vena cava syndrome, mediastinal syndrome, tumor lysis syndrome, hypercalcemia, febrile neutropenia. So here the symbol neutropenia means that is less neutrophils, that is WBC counts, that is less than 4000 cubic millimeter. So it will call neutropenia. Febrile neutropenia means fever with neutropenia, that is early symptom of sepsis. That is why it is an oncological emergency. Simple neutropenia, it is not an oncological emergency. Superior vena cava syndrome, hypercalcemia occurs in chronic cancer patients. That is because of demineralization of bones or sometimes overactivity of the parathyroid gland. That will increase the production of parathormone. That will increase the demineralization of the bones, and it will increase a calcium level in the blood. Septic shock, you know that because of the sepsis or the microorganisms spread through the blood, and it will causes shock, that is decreased BP and increased pulse rate. So these are the oncological emergency. In that, neutropenia, the symbol neutropenia is not considered as oncological emergency, but febrile neutropenia considered as an oncological emergency. And one more I forgot to explain, superior vena cava syndrome. superior vena cava syndrome, that means a group of conditions that is mainly due to any partial or complete occlusion of the superior vena cava. Partial or complete occlusion of the superior vena cava due to metastasis of the malignant tumors, and it will causes symptoms like facial puffiness and increased blood pressure on the upper limbs, and that will also reduce the cerebral blood flow. These are the main symptoms of superior vena cava syndrome. Syndrome means it is a group of condition. So main reason for superior vena cava syndrome is due to partial or complete block of the superior vena cava. So that the blood will not reach into the right atrium. Blood will not reach the right atrium, and so that blood will pool in the upper limbs and cerebral blood flow. And fourth question, the primary cause of diabetic ketoacidosis. Primary cause of diabetic ketoacidosis options: GI disturbance, insulin overdosage, omitted meals, not taking insulin regularly. So we know diabetic ketoacidosis. Diabetic ketoacidosis is due to hyperglycemia, that is increased blood glucose level. Diabetic ketoacidosis, that is mainly due to hyperglycemia. Hyperglycemia, that is increased blood glucose level, usually more than 400 to 450 above. If blood glucose level means it will leads to diabetic ketoacidosis. So what are the causes that we leading to diabetic ketoacidosis? In the options, there is a GI disturbance, insulin overdosage, omitted meals, not taking insulin regularly. A GI disturbance, it is not specifically will cause diabetic ketoacidosis, and insulin overdosage. Insulin overdosage means insulin will change, or overdosage means it is extra insulin that will change the glucose into glycogen, so there will not be adequate glucose available in the blood, so it will leads to hypoglycemia. So we can omit this option. First option we omitted because GI disturbance, there is no direct connection, GI disturbance and hyperglycemia. Insulin overdose, that will leads to hypoglycemia. So this option also we can omit. Then omitted meals. Omitted means the person is not getting adequate glucose from meals. So this will also leads to hypoglycemia. So we can omit the third option. Then fourth option only is there, that is not taking insulin regularly. Insulin is not taking means the available insulin in the person's body will be less. So there is no adequate insulin that will change the glucose into glycogen. So there will be increased glucose level. Increased glucose level means that is hyperglycemia. Hyperglycemia leads to diabetic ketoacidosis. So answer is option D, not taking insulin regularly. Then fifth question, the ECG changes due to hypokalemia. Important thing is hypokalemia. ECG changes seen in hypokalemia. Option: tall peaked T waves, prominent U wave, ST segment elevation, widened QRS complex. Hypokalemia, that main ECG changes, that is prominent U wave. Hypokalemia, U wave. In the case of hyperkalemia, that is increased potassium level, in that condition there will be tall peaked T wave. Hyperkalemia, tall peaked T wave. Hypokalemia, that is prominent U wave. ST segment elevation usually seen in myocardial infarction, and also it is seen in left ventricular hypertrophy. Widened QRS commonly seen in the case of ventricular tachycardia. So these are the ECG changes, main ECG changes seen in hyperkalemia, hypokalemia, myocardial infarction, and ventricular tachycardia. Sixth question. A 15-year-old boy is brought to the casualty with major chest injury with severe dyspnea. The life-threatening of chest injury in this case would be. So the boy with chest injury, and he is also experiencing severe dyspnea, breathing difficulty. So in the case of chest injury with chest injury, that is usually open chest injury, what would be the cause of death or life-threatening cause in the chest injury? Option A, diaphragmatic rupture. Option B, tension pneumothorax. Option C, tracheobronchial rupture. Option D, hemothorax. So in the case of open chest injury, there will be a chance of entering air from outside into thoracic cavity. So outside, atmospheric pressure is high, and inside thoracic cavity, the pressure is low. So because of that only, we are able to breathe in. So diaphragm is creating a negative pressure inside the thoracic cavity that helps to person breathe in. So if there is open chest injury, the atmospheric pressure from the outside, it will enter into the thoracic cavity and the pressure will be equal. So the person will not be able to breathe because it will not it will compress the lungs, and also it will compress heart, and it will move the thoracic cavity organs into different sides. So because of that, the persons will experiencing severe dyspnea, that is breathing difficulty, and finally it will leads to the death. So here correct answer is tension pneumothorax. Tension pneumothorax occurs when there is an open injury, open chest injury, then pressure of the atmospheric pressure will enter into thoracic cavity and it will compress the lungs. The expansion of the lungs will not occur, and it will also move the thoracic organs into sides. So that is known as tension pneumothorax. It is a fatal condition. So if it is not treated, patient will die. Seventh question. The pre-operative assessment warrants immediate notification to the surgeon is. The pre-operative assessment warrants immediate notification to the surgeon is temperature 101.5 degree Fahrenheit, serum sodium 135 milliequivalent per liter, bronchovesicular blood sound, and BP 135 by 80 millimeter of mercury. So it is easy question. You need to find which value is abnormal. That will be the correct answer. So here the correct answer is temperature, that is 101.5 degree Fahrenheit, that is abnormal. So that may be a sign of infection, or if it is kept untreated means it will take more metabolic, it will leads to more metabolism, and it will impedes the work of brain and like organs. So that is a important concern if there is temperature before surgery. First one is it may be a sign of infection, and another cause is temperature, that is fever condition, metabolic activity will increase. So these are the two reasons. If for fever, if it is fever means the surgeon usually will postpone the surgery, or first they will treat the fever, then only they will take the patient for surgery. Eighth question. Which of the following observations suggest a perforated bowel? Which of the following observations suggest a perforated bowel? Nausea, vomiting and abdominal distension, jaundice and clay-colored stool, rigid tender abdomen and absence of bowel sound, dyspnea and chest pain. If you are suspecting perforated bowel, which all are the symptoms will be there in your patient? So here correct answer is rigid tender abdomen and absence of bowel sound. If perforated bowel means our bowel contents will escape into the peritoneal cavity, the sterile peritoneal cavity, and it will leads to infections. So in the case of infection, the abdomen will be rigid. That is very firm during touch, and tender abdomen. Tender abdomen means while touching, patient will experience pain, and also there will not be bowel movement, or we cannot auscultate bowel sound. So these are the main signs and symptoms of a perforated bowel. In some cases, fever also will be there. Nausea, vomiting, and abdominal distension that is usually associated with paralytic ileus or any obstruction in the uh, bowel, upper GI tract. Usually, nausea, vomiting, abdominal distension usually seen in any obstruction in the upper GI tract or any paralytic ileus is there means nausea, vomiting, abdominal distension will be there. The same time, jaundice and clay colored stools are seen with any condition with liver. So any disease condition with liver that will leads to jaundice and clay colored stool. Dyspnea and chest pain that is usually related with any disease condition related to lungs or respiratory tract or heart issue. So I think it is clear. So we will go to next questions. The refractory error of the eye in which the light rays from the object are focused in front of the retina. The refractive error of the eye in which the light rays from the object are focused in front of the retina. Normally, the light rays should be focused on the posterior retina, but in this refractive error, it will focus in front of the retina. So, this is the example. So, options are presbyopia, option B hypermetropia, option C myopia, option D emmetropia. Correct answer myopia or short sight. In the case of myopia or short sight, the image, the light rays will focus in front of the retina. In the case of myopia or short sight, the light rays focus in front of the retina, so that will leads to difficulty in vision. At the same time, hypermetropia or long-sightedness, in that case, this image will focus behind the retina. So, back side of the retina, the light rays will focus. That also will leads to vision problem. In the same time, presbyopia is usually it is due to aging process. In the case of presbyopia, the lens shape is unable to accommodate or unable to change its size to accommodate the light rays. So that is presbyopia. Presbyopia is due to aging. Hypermetropia, the image, the light rays focusing, that is behind the retina. In the case of myopia, the light rays focus in front of the retina. Emmetropia means normal vision. That is usually in that normal vision, the light rays will focus on the posterior part of the retina. 10th question. A patient with rheumatoid arthritis has been taking steroid medication for 1 year. The nurse should assess for. A patient with rheumatoid arthritis has been taking steroid medication for 1 year. The nurse should assess for decreased WBC count, increased C-reactive protein, increased ESR, decreased serum glucose level. Here, correct answer is decreased WBC count. Due to the long therapy with steroid medication, it will leads to immunosuppression. That is that we can see in decreased in blood report, that is decreased WBC count, and increased C-reactive protein, that's usually seen in the case of infection. Increased ESR also we can see in the case of infection, and decreased serum blood glucose level, that is hypoglycemia. But with steroid medication therapy, usually we will see hyperglycemia. So in the case of chronic steroid therapy, there will be immunosuppression and hyperglycemia. Then that is important question today. The first human case of monkeypox detected in. The first human case of monkeypox detected in India, China, Democratic Republic of Congo, Brazil. The first human case of monkeypox detected in Democratic Republic of Congo. Monkeypox usually first it is detected in monkeys, then it is spread into humans. So that first human case that is detected in Democratic Republic of Congo, and why it is important today, that is first case of monkeypox detected in Kerala. The India's first case of monkeypox detected in Kerala, that is Trivandrum district. So that is important question that may ask now upcoming exams. So please remember, first human case of monkeypox detected in Democratic Republic of Congo. At the same time, first human case of monkeypox in India, that is detected in Kerala, Trivandrum district. Next question. World Blood Donors Day is celebrated on. World Blood Donors Day is celebrated on April 15, May 15, June 14, July 14. Correct answer is June 14. Blood Donors Day is celebrated on June 14. So that is about today's video. So thank you for watching this video, and please like and share this video with your friends. And if you have any doubt, you can ask in comment section. So thank you.